Welcome to the Madness and Grace podcast, where we discuss the connection between mental health and faith. I'm your host, Dr. Matthew Stanford, CEO of the Hope and Healing Center and Institute in Houston, Texas.
And I'm your co-host, Dr. Maddie Stiers, Chief Clinical Officer of the Hope and Healing Center and Institute. We're so glad you're joining us today.
Each week, we explore personal stories, expert insights, and the profound ways faith can influence our mental well-being. Whether you're seeking comfort, understanding, or simply a new perspective, we're here to journey with you. Thank you for tuning in. Now let's get started with today's episode. Hello and welcome to our latest episode. This is Matt Stanford. Here with Maddie Stiers, and today we're going to be talking about therapy and counseling. What's the difference between those two? How are you doing today, Maddie?
I'm good. I'm excited to talk about this and clarify some questions that we hear quite often.
Yeah, it's a very common misconception that people have. In fact, the words are used virtually interchangeably within mental health. You hear somebody say, well, I need to get therapy or I need to go to counseling, with little thought that there's a difference between the two. I know that I've run across that quite a bit. And really with me, the focus tends to be on trying to help people understand what appropriate referral is. Mm-hmm. You don't want to refer somebody that needs therapy to a counselor, and you certainly don't want to have to send somebody that just needs counseling to a therapist. Not that people that do counseling don't do therapy sometimes, or vice versa. It's just people tend to specialize a little bit. So maybe, Maddie, you could tell us a little bit about the kind of the differences or the key distinctions between therapy and counseling.
Yeah, I think that a lot of people, like you were saying, use these terms interchangeably, and there's nothing necessarily wrong with that. It just can become a little confusing. So therapy is typically what I consider a more structured modality. So you've got a specific type of therapeutic modality that the therapist has had a conversation with the client about, and they are actively working towards delivering that therapy. It's usually in a structured setting. There's a time frame that has been designated, and there are goals and a specific way that they're going about delivering this type of therapy. Whereas counseling is usually shorter. It's going to be for more generalized topics, kind of adjustment issues or certain life circumstances. It may not be a set time frame, and they may incorporate therapeutic aspects, but they're not delivering from start to finish a specific type of structured treatment.
Yeah, absolutely. I kind of think about it a lot of times as when you're dealing with therapy, you're typically talking about someone who has like a disorder, mm-hmm. a diagnosed disorder or a mental illness, someone who may have serious depression. And then, like you said, the therapist uses a particular therapeutic modality, a particular type of treatment that's been developed. So like cognitive behavior therapy or dialectical behavior therapy. Whereas with counseling, at least when I was in grad school, we used to refer to that as it's for people with problems, and so the worried well, a lot of times people would say. So, if someone's having a problem with their marriage or someone's having a problem with their parenting or they lost a job and they're really kind of down now and they can't really get themselves moving forward, but they don't necessarily meet criteria for a mental illness, they would need someone to walk along with them, someone to provide guidance, advocacy, encouragement. But also, occasionally, that counselor may use, components of therapeutic intervention. So, for instance, part of cognitive behavior therapy is stress inoculation, where you teach people how to deal with kind of heightened arousal and kind of maybe you might use a breathing technique or something like that. Well, a counselor certainly might teach their client a breathing technique to help relax them, but they wouldn't necessarily do all of cognitive behavior therapy, and so they might use components. So I think that's probably a good way to think about it as well. What you might think of as the intensity of the problem or the severity of the problem. And so if it's more of an acute kind of an issue that just kind of comes up and it's kind of environmentally generated or, like an event occurred or something like that.
Normal life stressors,
exactly.
Everyday stressors that everyone has, counseling.
Exactly. So I think that's the way to think about it. It's not that one's better than the other. It's just a different kind of level of intervention.
For different needs.
Absolutely. Different needs. I think that's a great way to say it. Now, as far as the qualifications for somebody that does counseling versus someone who does therapy, typically people that do counseling have a master's degree. That's not always true. There's certainly people that have doctorates that do counseling, but more often than not, a person will have a master's degree, and they may have a licensure like an LPC, a licensed professional counselor, or there may be an LMFT, licensed marriage and family therapist, which is very confusing because the term therapy's in there, and they tend to do counseling more often than not.
Sure.
Or a licensed clinical social worker. All of those individuals may do, some type of counseling. But for people who do therapy, more often than not, that person's going to have a doctorate in clinical psychology. Although you certainly find licensed clinical social workers that do therapy. You can even find LPCs that do therapy. So it could be a master's or a doctorate. But you really have to check these things out ahead of time. And I think that's one of our challenges to our listeners today is if you are going to be referring people or you're looking for mental health services yourself, you need to make sure that you've checked with the individual about what it is that they actually offer and what kind of clients they actually see. Because you may find yourself in a counselor's office when maybe you have bipolar disorder and you're looking for a therapeutic intervention, or vice versa. You may find yourself in a therapist's office when really all you're looking for is some kind of marital counseling or some advice or guidance in the context of parenting or something like that. So what about some misconceptions related to therapy and counseling? What are some that you've run into?
Misconceptions about the difference of the two, or
It
just
doesn't
in
matter.
general?
Just in general, I think.
Yeah, I think that people, think that they're the same thing. But I think when you hear a lot about talk therapy,
Right.
all of the online spaces that have come out now, and I think that we're moving in a direction in society where people are more willing to talk about their mental health and they're more willing to seek support. But I think the biggest misconception is that if you're looking for a therapist or a counselor or whatever the support it is that you're looking for, that means that you're weak, that there's some failing with you, that there's something innately wrong with you. And I think that's going to prevent people from taking that step to working towards identifying, do they need a counselor or do they need a therapist? I think that's one of the biggest misconceptions about starting therapy and jumping into that, or counseling. I think a lot of people also feel like, I don't know where to start. It's going to be very confusing to figure out what kind of provider I need. That may not be a misconception, because that is actually, in fact, can be a bit challenging. Matt, you've talked a little bit about master's level providers versus doctoral level providers, but I think the other thing to mention in there is psychiatrists. We have the therapists and the counselors who are providing the therapeutic and the week-to-week sessions that you typically think of as therapy or counseling. But we also have a psychiatrist who is an MD, who's gone to medical school and is specialized in working with individuals who struggle with their mental health, some mental health issues. They're actually going to be the provider that is prescribing medication.
Right.
They are not as likely to provide therapy or counseling. They used to in the past, but oftentimes nowadays, especially if they're taking insurance, they're just going to be doing medication management. And if you go into a psychiatrist's office hoping for therapy, which unfortunately I hear so often with people here, they'll say, thought I was going to get some help, and all they did was ask me about my symptoms, and I talked to them for 15 minutes, and they gave me a prescription and told me to go away. I'm like, yeah, that's what a psychiatrist is going to do, which is super helpful. That's their job.
Right.
But if you're looking for therapy and you end up in a psychiatrist's office, you're going to be sorely.
I've had people tell me that they were getting therapy from their psychiatrist, and they misunderstood that the 15 or 20 minutes the psychiatrist spends with you on a follow-up appointment where they just kind of ask you how you're doing. They thought that was therapy.
Yeah,
and
I've seen
now,
that.
typically, psychiatrists that were trained prior to 1980 were still trained to do therapy in addition to using medications. But after that, most medical schools have moved away from any kind of training. There are still a couple, and occasionally you may run into someone, or if you have an older psychiatrist, they may do therapy. So you certainly need to check on that. But yes, making just 15, 20 minutes with somebody, even the 45-minute to an hour intake that a psychiatrist does on the first visit, that's not therapy. That's just history taking and getting information. So, I think it's really important that we understand that. I think another misconception that I have run into is this idea that people don't think that therapy works or that counseling is important because it's just talking to somebody. So they're like, well, what is that person going to tell me that I don't already know? Like it's just, or, I've got plenty of friends to talk to. I don't need to, and so I think, the important thing to understand is you're talking to a trained professional who's trained to help you learn how to work through problems, how to focus on particular symptoms you might have if you're dealing with therapy, things like that. And when we're talking about therapy, we're talking about very structured treatments and interventions that have been developed. And what's been demonstrated with those when you use, say, fMRI or PET scan is you actually have neural changes that occur. And so as a person begins to show progress, say, with severe depression, you actually see changes in the brain that are permanent changes related to therapy. So this isn't just sitting down with somebody and kind of vomiting out your problems, and then they just kind of go, oh, that's nice, how'd you get along with your mother, which is kind of the joke. This is with therapy, a very structured treatment of the particular problem that you have. With counseling, it is more than just paying for a friend to sit there and listen to you.
Sure.
There's a structure. They're following a protocol. They have a sense of what the underlying problem may be. A lot of times people don't really understand what their real issue is anyway. They say, oh, I don't understand why I can't get up in the morning or whatever. I mean, but a trained counselor is a mental health professional that can help you figure out what's really going on and help you begin to move forward and make progress. So I think this idea that it's just like, sitting down with somebody that's nice and you pay them and they just say nice things to you or they just listen to you and nod. I think that, you really have to get beyond that. This is a treatment on the therapeutic side for serious mental health issues. And on the counseling side, it's more than just you saying your problems and they say, oh, I'm sorry that's happening to you. It's a very structured, guided type of intervention. So I think that's an important thing for people to understand. I also would say this, we've talked before that in the context of counseling, particularly, there are levels of counseling that do not require licensure. So something like pastoral counseling or lay counseling that's just done by laymen at a faith community, or even what we might see as a peer coaching or peer recovery counseling or certified peer specialists, which are all people who have lived experience with these issues and they can provide support and encouragement and comfort. And so, I think that's important to understand too, so that even within the context of counseling, there are different levels below the professional counselor who's licensed. And sometimes those are tremendously beneficial for people, and that may be all they need. But we have to make sure that we understand that there's a difference between counseling and therapy, and there certainly is a difference between therapy and kind of unlicensed counseling, just like there's a difference between licensed counseling or professional counseling and counseling done by non-professionals or paraprofessionals.
Yeah, absolutely. I think this is exactly what can become confusing for someone who is not a mental health professional, is you've got like Stevens ministers or mental health coaches that are paraprofessionals and peers that have lived experience and are able to work with you in same kind of way an AA sponsor might, right? Then you have licensed mental health care providers at master's or doctoral level, like you said, social workers, LPCs, LMFTs, and then you have doctoral level psychologists and social workers. And then on top of that, you have MDs, psychiatrists that are prescribing medication, but also might be doing therapy. And is it therapy or is it counseling? Right. So, if someone were to say, I'm needing help, Matt, where do I go? Right. Obviously here we help people find resources, but if someone was wanting to navigate this on their own, what suggestions or advice might you give them as they're navigating finding a provider?
Yeah, I mean, that can be a very difficult thing if you're just trying to do it on your own. If you don't have a kind of trained set of ears that can listen to what the issue is and kind of help direct you in the right place. I mean, really, I think the first thing the person has to ask themselves or the family has to ask themselves about the individual is kind of what level are we dealing with? What are we dealing with here? Does this look like it is a mental disorder, a mental illness? It's, say, impairing their ability to function on a daily basis? Has it grown to a very serious level like that, where the person is, just laying in bed all the time, or they're having extreme mood swings, or they seem delusional? If you have those kind of extreme symptoms, or it seems to be a very kind of high level, high intensity, where the person's impaired in their daily functioning, well, then you're talking therapy. And so that kind of individual certainly needs to see a therapist and may need to see a psychiatrist. If you're talking about a more of a episodic type of an event where it's tied to a circumstance, you're not getting along with your spouse, you've been having trouble with your children, you lost a job and now you're really down, those types of things that are, again, problems that people have, but that in this instance, it's kind of overwhelmed you, which is understandable. If your spouse died, that's an overwhelming event. And so, that's when you would seek out a counselor. Now, whether you need to go to a pastoral counselor or a Stevens minister, a lay counselor, or a professional counselor, that really, again, depends on the kind of the intensity of what you're dealing with. So, my recommendation would be, start with whatever's most easily accessible. And if you're at a faith community and they have lay counselors there and you think you might need a counselor, well, start with one of them, because they at least have the training to help you understand whether you might want to go on to something more.
Sure.
An easy place for everybody to start, regardless of what they're dealing with, is their primary care physician. So, I would recommend to somebody who, say, doesn't have access to a place like the Hope and Healing Center or an organization that can help you understand what's going on and then kind of move you towards the kind of care that's best for you, start with your primary care physician and just go and share with them what's going on. If you don't have a primary care physician and you're not able to get into one, then, start with your pastor, start with a trusted friend, talk through what's going on so that you have at least some other input into, what level that you're struggling with. Because a lot of times, again, it's not easy for you to recognize that. The other thing is, if you know someone who's had a similar problem, that's a great place to go as well. So I guess the take-home message on all that is kind of try to get someone else to kind of help you understand that, because a lot of times it's difficult. But I will say this, if you go to the wrong type of mental health care professional, they're trained to recognize
that you might need a different level
exactly,
of care.
And then they can move you on to that. I mean, if you take your loved one to a licensed marriage and family therapist who the description of what they do is pretty much in their name, they work with marriage and family issues, and you take your loved one there and your loved one has a psychotic disorder, and that's why you took them there, that licensed marriage and family therapist is going to go, well, this is way beyond my training. And so what I'm going to do is I'm going to give you a referral. So don't be concerned about that. I would say on the flip side of that, if you are a referral maker, so you're a pastor, maybe you're a physician, whoever, you're in a position that people come to you with issues, and then they want you to help them find. It's very important that you understand the difference between not only these kind of modalities of treatment, but that you understand that this LPC does see people for serious mental illness, and this LPC only sees people that are dealing with marriage and family issues or parenting problems. You really have to get that information ahead of time, because sometimes it's worse making a bad referral than a good referral, because people get worn out.
And if you're in the middle of a mental health struggle, and you're having to call someone, and you've called your pastor, and they're saying, okay, well, just call these people. When you're calling all these people, and they're saying, well, we can't work with you. Eventually, you get so many doors slammed in your face that you give up, and that's not what we want. We want people to be able to find access and find care. So if you're, like you're saying, if you're a referral maker, it's important to, just touch base with the therapist. Say, hey, who do you work with? Who can I be sending to you? Quick conversation. Very, very easy.
And I think within faith communities, what I've seen for pastors who do and ministry staff who do make referrals, a lot of times the first and most comfortable default is to just kind of refer to your local Christian counselor. And I think just in the name itself, or that the description there, Christian counselor, more often than not, Christian counselors are counselors. They're not always counselors, but more often than not, they are counselors. And the two most common degrees that they have, I've actually did a study on this. Two most common degrees that Christian counselors have in the U.S. is an LPC or an LMFT. That doesn't mean everybody that has those, all they do is counseling, but those are the two most common. And so what you find is those individuals tend to deal with people who have problems. They don't tend to deal with serious mental illness. So if you send somebody to an LPC who normally works with people with problems, who has bipolar disorder and it just came out of a manic episode with psychotic features, they're not going to know what to do with that, and they're going to have to move them on. Now, I know the tendency in the faith community is to try to refer, or in the Christian faith community anyway, try to refer people to individuals who are themselves practicing Christians and even perhaps advertise themselves that way in their practice. But the reality is that there's a lot of Christian counselors out there. There aren't a lot of people who identify themselves as Christian therapists. You just don't see that advertised that way, like a Christian psychologist. I mean, there's certainly some. So it's harder to know that. And so, what I really would caution people is, find out what your local Christian counselor likes to see, what kind of counseling or therapy they do, so you know that ahead of time. But also, you recognize that if you're only going to refer to people who advertise themselves as Christians, then you're really going to cut down the pool of referrals that you're going to actually have. That may be okay with you, but I'm just saying what we do at the Hope and Healing Center is we're much more interested in trying to find a faith-affirming environment. I know that a lot of pastors are concerned about sending their congregants to people who maybe aren't Christian and are going to do counseling or therapy on them. And so, I'd like us to speak a little bit in the last remaining time that we have, just to the idea of kind of the concern or the caution they have. I think a lot of times what I hear anyway is this idea that somehow they're going to undermine their faith and convince them to do things that they shouldn't be doing. Have you ever heard anything like that?
Sure, yeah. And I also hear the idea that if someone doesn't identify as a Christian counselor, that they're not going to be willing to discuss the client's belief system, Christianity, whatnot at all, which usually isn't the case. I mean, whether the counselor or the therapist identify as a Christian or not, clients show up and tell us what they want to talk about. And usually any ethical mental health care provider is going to say, okay, you want to talk about this? Let's talk about it. And how does that look? How is that supporting you in your day-to-day life? How is that a strength? Or has it become a hindrance? And is there abuse happening? So they're evaluating and assessing. They're trained to do this. And, we know that most of our clients want to be asked about their faith. Not just our clients, but most people receiving mental health care.
That's what the research shows. The majority of them want to discuss their faith because the majority of people, the vast majority of people in the 80s to 90% of people identify themselves as religious and spiritual.
And providers want to be discussing it with clients. They think it's important too.
You said something that's important, I think, for us to really emphasize, and that is the idea of being an ethical therapist or a counselor. There is not a professional licensing organization. So the organizations who provide the licensure for clinical psychologists or licensure for LPCs or licensure for social workers. There is not a professional mental health licensed organization that does not have in their code of ethics for their licensed professionals include a multicultural component.
Or the client's right to self-determination.
Absolutely. And that the therapist or the counselor needs to be competent in dealing with these multicultural issues, of which religion and spirituality is always listed as one of those. So any therapist, any counselor that would say to a person of faith that they were working with that, let's not worry about that. That's just mythology, or you can talk to your pastor about that. There really isn't time for us to talk about that here. They are, by definition, within their own licensing organization, being an unethical
incompetent.
And that's just a fact. That doesn't have anything to do with whether they're a believer or not, or a person of faith or not. That's just considered incompetent. So if somebody sits down with a licensed therapist or counselor and says, well, I've really not been able to connect with God in the context of this depression I'm dealing with. I really feel like I might be punished for that, and this is why I'm having this. If the therapist were to ignore that, dismiss that, tell them that that's simply just not true, forget it, let's just move on, that's just bad therapy, bad counseling, and they literally are in violation of their own code of ethics.
Well, and I would question whether that provider is practicing competently in other areas as well, not just that. So it becomes you have in every field, you have people who do their job well and people who don't. And so that's something that you have to determine as you're working with someone. We call it kind of like you got to date your therapist, don't actually do that, but get to know them, see if you connect, if you vibe. If you have concerns that maybe they're not practicing well, it's okay to find a new therapist, find a new counselor, say, this isn't what I need,
And we could sit here and list any number of multicultural issues. I mean, if you were let's say you're a second generation immigrant to this country, and you go into therapy and you're dealing with depression, and you say to the therapist, well, my parents don't understand me because, they're from the old country, and in the old country we're told don't talk about these things. It's a shame. And I really feel a lot of shame because of this. Well, again, if the therapist or the counselor, whoever they're dealing with, goes, well, just forget that. That's not true. Let's move on. That doesn't have anything to do with this. Again, that's just as wrong, just as unethical, just as incompetent. And so we don't want to, we're not supposed to treat religion and spirituality as different than these other things. I say it a lot of times, I'll say it like this. If the client comes in with certain core beliefs and views and understandings, and it's the job of the therapist and the counselor to determine the strengths that are within the person and help them to access those to begin to move through or process what they're dealing with. And faith can be a tremendous, tremendous strength for an individual, but it also can be a decrement at times if a person begins to adopt a negative kind of religious coping approach, where, for instance, they think God is punishing them, or it's demons that are causing their problems, or things like that. It can be the role of the therapist or the counselor, regardless of whether they're a person of faith or not, to help steer the individual to the more positive aspects within their faith tradition. And again, I think the problem comes in here in that, unfortunately, we've convinced ourselves in our culture that we're not supposed to talk about our religion or our faith because that causes all kind of problems, which isn't true across a lot of cultures in the world. They talk about their faith all the time. And so people are standoffish about their faith. And I think therapists are very concerned, because they don't understand a person's faith, perhaps, that they just kind of dismiss it. They ignore it. And again, that's just not right. That's just not a right thing to do.
It's interesting because I think about, as you mentioned, we talk about, we're not supposed to talk about our faith or our religious beliefs. We're also not supposed to talk about money. And you go in and sit down with a counselor or a therapist and you're having financial difficulties. As a therapist myself, I may not understand your exact financial situation, but I'm going to ask questions. I'm going to dig to get a better understanding. And then I'm going to walk with you through, what are your goals? What are your needs? What do you like? How can I support you in that? What are we looking to do? I would never say, well, it's unfortunate that you can't figure out how to get your financial, self together, but we're not going to talk about that because we're not supposed to talk about money. It's uncomfortable.
Can you, as a competent counselor or therapist, with the skills that you've learned, can you help that individual problem solve? Can you help them
identify issues?
Identify issues, connect with strengths within them, recognize problems that they're having and how they might overcome some of those issues, what the barriers are to overcome. I mean, those are the kind of things that a counselor does, that a therapist does. A therapist is just dealing with a higher level of seriousness of illness, and they're using a more structured intervention.
Sure, an evidence-based.
And so, I always find it really odd. Here at the Hope and Healing Center, we use an integrated approach to care for people with serious mental illness. I mean, we also, in our therapeutic interventions, which are cognitive behavior therapy and dialectical behavior therapy, We have faith-based integration within those. And we also use medication and case management and other things like that. But I get asked all the time, and I'm always asked by Christians. So I want to just preface that. I'm never asked this by people in the secular mental health world. I'm always asked by Christians. In fact, I was just asked last week on a Zoom call I was with a whole set of Christian providers, people in mental health and faith. They ask specifically, well, do you get a lot of pushback from the mental health world, the secular mental health care world? Do you have problems with licensing boards in your state because you're a Christian? Do you have problems with, and the answer 100% of the time, and for my entire career and everything we've ever done, is absolutely not. I don't understand the conflict that people think exists. If you are competent in what you do, and I would go so far as to say that the Hope and Healing Center, we're more than competent in what we do. We do an excellent job. People are lining up to work with you if you do a good job, and they are. They're lining up to work with us, whether they're people of faith or they're not, because they want people to get better. And so, we also have plenty of people that come to the Hope and Healing Center, and we can close with this idea. And I think you can speak to this really well. We have plenty of people come to Hope and Healing Center that don't even believe in God, and they're not even interested in talking about their faith. Although I would suggest that more often than not, it comes up.
Absolutely, absolutely. That's what we always say is important. Is you have to ask the question, because you've then presented, hey, there's this door here, right, and they can say, I don't want to open it. And you go, okay, great, but they now know the door is there. And if they choose to open it, we're here. We're going to have that conversation. Absolutely. Just like any other topic. If a client goes, I absolutely do not want to talk about that. Sometimes we have to push a little bit, but we're working with people where they're at. And absolutely, people show up and say they do or they don't want to talk about it. Ultimately, it usually does end up being a part of the conversation.
Absolutely. I think that's another sign of a good therapist or counselor, is the fact that you recognize that you're there to assist the client. You're not there to tell the client what to do, to somehow fix them in the sense of I'm just going to give you some medicine, go home and take that, you're going to be fine. Here, I'm going to give you 2 things to say to yourself, you'll be fine. You're there to walk them through. I mean, that, especially in trauma therapy, we talk about processing the trauma. That's literally, not to use the word again, it's a process that you have to walk through with the person, and they have to do the work. And so in therapy in general, the client has to do the work. You're just there to point,
facilitate,
and provide and facilitate. You provide certain types of interventions and you facilitate them doing those, but they have to do the work.
That's what I tell every client that I've worked with that has said, thank you, you've helped me so much. Great. I'm so glad to have been able to walk with this through this with you, but you did it.
Right.
I said, hey, this is what some treatments show work for this, but you took it and you actually did it, which is ultimately the hard part. It's easier to talk about in a room that's safe, but to take it out into your life and actually start to implement things and move forward and take what you've learned and implement it is very challenging. So,
in closing, I would just say, if you're someone out there who needs help, please reach out. That's just the first step. It doesn't matter whether it's the right place you need to reach out to or not. Just reach out to a friend, to a pastor, to a primary care physician. Just take that first step, because it could be life-changing. And if you're a person who makes referrals, do your due diligence and learn the difference in these therapeutic interventions. Learn from the people in your community that provide services. Get to know them so you feel comfortable referring to them. And if you're a therapist out there or a counselor, contact pastors, contact primary care physicians. Let them know that you're available for referral. Let them know who you are. That makes a huge difference as well. So I don't think we need to be afraid of therapy anymore. We don't need to be afraid of counseling. We need to understand that there's a huge crisis out there of mental health issues. And there are great and effective interventions that are available, both faith-based and non-faith-based. We just need to do the best we can to get people to the care they need.
Thanks for listening to this week's episode of the Madness and Grace podcast. Make sure to subscribe wherever you listen so you'll never miss an episode. While you're at it, if you found value in this conversation, we would love it if you would rate us and leave us a review. Lastly, sharing this podcast with a friend or a family member is a great way to give hope to those who may be struggling with a mental health concern. See you next time as we discuss madness and grace.